because I've got some Estradot Conti patches in my room. Now, if you think back, I talked about this recently and I wanted to discuss the pros and cons of having these Estradot patches, because this has got the combination of estrogen and the progesterone component in a nice handy little patch, and these are quite small as well, and this works really well for postmenopausal women who still have a womb, or those who haven't got a womb, so have had a hysterectomy but have a background history of endometriosis, so need their estrogen and their progesterone component. But why would you want these type of patches anyway? Because we already do have Everil Conti, Fem7 Conti. We've got quite a few combination patches. These have come in a handy little smaller size, and also the dose is slightly different. There are two Estradot Conti patches out there, 1395 micrograms, and the one that I've got here, which is 130 micrograms. So it releases 40 micrograms of estradiol and 130 micrograms of norethindrone every 24 hours. And each patch is about 7 centimeters, so very small compared to all the other patches that we've got out there. Comes in either boxes of 8 or 24. And these patches are changed twice weekly. So very simply, put anywhere below the belly button and you just change them twice weekly. Nice and easily done without you having to worry about what combination to take. So the advantages of that is that you don't have to take the tablet micronized progesterone, or remember to take any other form of other progesterones that you might have. And also it comes in a lovely dose. So some patients who are either weaning down or want to have that slightly extra on top of their estrogen or progesterone component that they're already taking, then having these sort of combination of doses can work quite well in order to manage the menopausal symptoms such as hot flushes, night sweats, anxiety symptoms, irritability, low mood, anxiety, and also libido as well as brain fog. So having that combination can work really well. Now, some patients actually might just need the progesterone in a slightly different way, and the combination compares quite well. Now, the cons of having these patches, well, compared to Everil Conti, which has 50 micrograms of estradiol, these do have a smaller dose in them. So like a lot of the combination patches out there, the progesterone is not body identical. Some women can be sensitive to synthetic progestin or progesterone and have side effects such as skin changes, headaches, fluid retention, and low mood and irritability. And because it's transdermal, the delivery of the synthetic progesterone can actually be considered slightly safer, with smaller risk of, say, clots than the oral version of synthetic progesterone that you're taking. And we still are debating, there's lots of debate around synthetic progesterone and breast cancer compared to the body identical micronized progesterone. So there's a lot of stuff that we still need to work out when it comes to synthetic progesterone and also micronized progesterone, as well as going orally or transdermally. But we do know that the absolute risk is low for healthy women under the age of 60 or within 10 years of menopause. But I just wanted to give you a little show that these are available. We still need to work out Estradot supplies of the Estradot only patches. Yeah, I know that there are still issues around that. But if you are considering taking estrogen progesterone and just probably want either a lower dose or maybe a slightly increase in the combination that you've got at the moment, it might be having a chat with your NHS GP, because this is available on the NHS.